When you have rhinoplasty with septoplasty. If you have medically documented nasal breathing problems and also want to change the shape and size of your nose, you might consider combining septoplasty and rhinoplasty, what's sometimes called septorhinoplasty. You'll have to find a facial plastic surgeon who is trained as an ENT or ear, nose, and throat doctor, and here's a guide. What is the difference between rhinoplasty and septoplasty? While rhinoplasty and septoplasty both refer to surgeries on the nose, rhinoplasty is usually an elective cosmetic surgery focused on improving the nose's outer appearance, while septoplasty is a medically necessary surgery done to correct a nasal breathing problem. Rhinoplasty involves manipulating bone, cartilage, and nasal tissue to refine, reshape, or reduce the shape of the nose. It can be a life-changing procedure for those who are self-conscious about a nose they feel is too large, prominent, or misshapen. Septoplasty involves reorienting or straightening the nasal septum, which is cartilage and bone that is the divider between the two sides of your nostrils. A septoplasty will fix a deviated septum or obstructive breathing problems, but will usually not change the outer appearance of the nose by much. Can I get a rhinoplasty with septoplasty? Yes, and it is becoming increasingly common. A septorhinoplasty combines both internal surgical realignment of the septum and external cosmetic nose reshaping in one procedure. If you have a documented structural nasal problem, like a deviated septum, cleft palate, chronic sinusitis, and large turbinates or narrow internal nasal valves, you will likely need what we call functional nasal surgery to allow you to breathe more easily through your nose. This can include septoplasty, sinus surgery, partial reduction of inferior turbinates, or repair of the internal nasal valves. Septoplasty is often covered by insurance if it is deemed medically necessary and more conservative treatments have failed, though it is always recommended to get pre-authorization from your insurance company. What is the average cost of septoplasty and rhinoplasty? The cost of septoplasty and rhinoplasty will vary based on whether the procedure is covered by insurance, what part of the country you live in, the extent of the surgical work to be done, and the expertise level of the practitioner. That said, recent national averages for septoplasty are anywhere from $6,000 to $8,000, though note that septoplasty is usually covered by insurance if it is medically necessary. Recent national averages for rhinoplasty are also in this $6,000 to $10,000 range. Unless it is a functional rhinoplasty, the patient will need to pay out of pocket. Unfortunately, insurance doesn't care if your nose is straight. For patients who already need a septoplasty and want to make cosmetic changes to their nose at the same time, the combination septorhinoplasty is the best option. Insurance will often cover the septoplasty portion of the procedure, with the rhinoplasty portion to be paid out of pocket by the patient. If the upfront cost of the rhinoplasty portion is a prohibitive factor, ask your surgeon about financing options. At your initial consultation with your prospective surgeon, you will receive a more detailed estimate of the fees. What is the recovery from septoplasty and rhinoplasty like? Septoplasty alone is generally pretty easy. It heals the fastest, all the work is done inside the nose, less manipulation of bone and cartilage. Most people feel pretty ready to go back to work after about 3 days, although it takes several months for all the swelling to go down and the functional results to be fully apparent. So you may have heard horror stories about the packing in your nose after septoplasty. It seemed like for days there was hard packing that was uncomfortable. I don't do that at all. I've actually done a study of over 1,000 patients to see if it makes a difference, and it makes absolutely no difference. So overnight I just put gauze inside your nose just to help keep the swelling down, the oozing down. I take it out the next morning and then you will have no packing in your nose. That is one of the factors that keeps people from coming back and having surgery to fix problems that they had from a previous surgery because the packing was so horrible. So don't worry, we don't do that anymore, and it's much more comfortable of a recovery. Rhinoplasty takes longer to heal, but combination septorhinoplasty should take no longer than the rhinoplasty alone, because that's the part that takes the longest. You should plan to take about 10 to 14 days away from work or regularly scheduled activities. Most of my patients feel good and feel like they would be able to go back to work after 5 days, but I do keep tape on your nose until day 10. So it depends on what kind of work you do and whether or not you're okay with people seeing the tape on your nose or not. So most people, after I take off the tape, if they don't want anybody to see at day 10, they're able to go back to work. If you have bruising at that point, it's easily covered by makeup. Most rhinoplasty or septorhinoplasty patients feel perfectly comfortable going out in public after 2 weeks and are extremely satisfied with the results at about 3 weeks to a month post-op. You'll see that the swelling goes down from the top to bottom. So you'll see the swelling go down here at the top. Around a month, a lot of this has come down, and then the tip is the last place for the swelling to go down. It may take a full year for all the swelling to resolve, but 80 to 90% of the swelling is gone in about 3 months. And patients usually feel happy about taking photos and going to weddings, going to events, things like that. Definitely in a month, and for sure at 3 months. What is a turbinate reduction? A turbinate reduction, in my opinion, is a vital complementary surgery to a septoplasty. Turbinates, as I describe them to patients, they look like a hot dog structure that's on the inside of your nose. This shrinks and swells to filter, heat, and humidify the air that's going in through your nose. What can happen is if your septum is very deviated, this turbinate on the opposite side will actually swell to accommodate that space. And so if you simply straighten the septum and you don't reduce the turbinates, the side that was your good side then becomes the bad side. So in most cases, I will straighten the septum and reduce the turbinates in a number of different ways. You can use cauterization, coblation, radiofrequency, a lot of different ways to get to the same endpoint. The idea is just to make these bigger turbinates smaller so you have more space in your nose for air to get through. A lot of people will notice that they have problems with their turbinates and they don't know that that's what it's called because they have some trouble breathing at night when they lay flat or in the morning. And a turbinate reduction can be done on its own, but most of the time it's done with a septoplasty to address these breathing problems. Do I need a rhinoplasty and septoplasty surgeon near me? If you're in the Houston area and interested in septoplasty, rhinoplasty, or septorhinoplasty, ensure that you have an expert facial plastic surgeon to perform your procedure. It is not uncommon for my patients to fly in from elsewhere to have me perform their septoplasty, rhinoplasty, or combination septorhinoplasty surgery. Have questions? I genuinely look forward to speaking with you. Email me anytime. Thanks for watching.